I think the most satisfying part of my work is when I've had a day where I know that I've made a difference in that patient's life. My name is Winona Windsor, and I'm a diagnostic imaging technologist in the Northern Lights Regional Health Center. When the traumas come in, like we're firsthand, we receive them to our X-ray table. Sometimes the treatments haven't even started when we receive them. But when you look at the fact that you've been a part of a team that can practically see inside the body, it gives you a real sense of pride. Before I graduated, I went through a very severe illness that nearly took my life. So from that moment on, I had a deeper understanding of people, to be able to relate to them and to just want to help. The first 2 years I worked in Corner Brook, Newfoundland, and that's where I met my boyfriend, who's now my husband. He couldn't get a job in Newfoundland, so he went to Fort McMurray. 39 years we've been there now, and it is home. It was on a Tuesday, and May the 3rd, and there had been smoke on the Sunday evening, but it had seemed to have gone away. So I just went to work like a normal day. Probably about 1:30, when I walked out to the parking lot of the hospital, I just looked up behind the hill. It was already starting to catch fire, and I could hear explosions going on further up where the fire had started, and there were like gas stations that were exploding. My heart just fell to my feet. We had to have a convoy to guide us out through the smoke. Then we went straight on into Edmonton and got there about 2 in the morning. They were flying people back into Fort McMurray. I said to my manager, I want to go back and help. I want to go back and help set up. One of the most important parts of our recovery was very dependent upon our Health Sciences Association members. We had to have lab, we had to have X-ray, we had to have pharmacy, we had to have biomed, we had to have respiratory. The techs were amazing. They came from all parts of Alberta, and they were bringing in the firemen that they knew seemed to be struggling a little bit with their breathing. We had our portable machine set up to make sure that we could take the chest X-rays for them. My boss wanted me to take a break, and I said, no, I want to go back. I want to go back, and I want to see this, progress further, because we were just getting started.